Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. Cerebral Palsy. Introduction.
Cerebral palsy, or CP, can cause serious neurological symptoms in children.
Thousands of children are diagnosed with cerebral palsy every year. This program explains cerebral palsy. It talks about the symptoms and causes of the disorder. It also explains how CP is diagnosed and treated.
Cerebral palsy. Cerebral palsy is the name given to a group of disorders that affect a child's control of movement. These disorders appear in the first few years of life.
CP is caused by problems with the motor skill areas of the brain. These areas may develop abnormally or get damaged. This disrupts the brain's ability to control movement and posture. Even though the brain damage that causes cerebral palsy does not usually get worse over time, symptoms can get worse. Muscles can get tighter. This may lead to more joint deformities. Joint deformities can lead to increased pain. Fine motor skills can also get worse, as well as bladder and bowel control. Difficulties in breathing can also show up. People used to think that CP was caused by an injury during birth. Now we know that CP can happen before birth, during birth, or in the first few months of life.
Symptoms and complications. Symptoms of cerebral palsy include difficulty with fine motor tasks, such as writing or using scissors, difficulty maintaining balance or walking, weakness in an arm or a leg or a combination of both, involuntary movement, excessive drooling when it affects the muscles of the face. Early signs of cerebral palsy usually appear before 3 years of age. Infants with CP are often slow to reach developmental milestones such as learning to roll over, sit, crawl, smile, or walk. Symptoms differ from person to person. They may be very mild and barely noticeable or very severe, causing the patient to be bedbound.
Some people with cerebral palsy are affected by other medical disorders, including seizures or mental impairment, but cerebral palsy does not always cause severe handicaps.
CP can cause muscles to become very tight or spastic, causing contractures. A contracture is severe muscle tone that makes it impossible for a joint to move. This can lead to abnormalities in joints. CP can cause muscles to have no tone at all, making them limp and floppy. This can lead to joints dislocating because the muscles do not help stabilize them.
For children who have problems swallowing, getting the right nutrients can be a problem. They may require the help of nutritionists. Some medical conditions that can accompany CP can make health conditions worse for patients. These include seizures, intellectual disability, problems with vision, hearing, and speech. Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials.
Causes and risk factors. Meningitis or infection of the coverings of the brain and spinal cord has been linked to CP. Abnormal brain development, whether inherited or due to injuries while in the womb, can result in CP. Such injuries may involve lack of blood flow to areas of the brain or bleeding inside the brain.
If a mother gets certain infections during pregnancy, CP can also result. Such infections include rubella or German measles.
It is very important for women to have rubella vaccinations before becoming pregnant. Good prenatal care helps decrease the risk of CP by preventing premature births, low birth weight, and infections affecting the mother. CP can also result when a baby's blood type is different than its mother's blood type. Some of the baby's red blood cells may be destroyed, causing high levels of a special chemical called bilirubin. Bilirubin causes skin to turn yellowish, a condition called jaundice. An increase in bilirubin can also cause brain damage and CP. Severe head injury in the first few months of life has been associated with cerebral palsy. In addition to the many possible causes of CP that are known, there are still many cases of CP that have no known cause.
Healthcare providers have identified some other risk factors associated with CP. This does not mean that people at risk will get CP. People at higher risk of developing CP include babies born prematurely or with a low birth weight. The smaller the baby, the higher the chances are that CP will develop.
Babies of mothers who had vaginal bleeding during pregnancy. Babies of mothers who had very difficult labor, especially breech births. Breech means that the baby is not in the usual head-first position as it enters the birth canal. Babies who had meconium staining. Meconium staining is when the baby passes stools while still in the uterus. Diagnosis.
Healthcare providers diagnose cerebral palsy by testing motor skills and reflexes, looking into medical history, and using specialized tests. CT scans or MRIs may be done in order to look more closely at the brain and rule out other possible causes of symptoms. Other health conditions can have symptoms that are similar to the symptoms of CP, including brain tumors, water on the brain, and bleeding in the brain. Treatment.
Currently, there is no cure for CP. The brain damage that leads to CP is not curable. CP treatment focuses on making the best of the situation through therapy, drugs, surgery, and mechanical aids.
Physical therapy helps strengthen muscles, improves walking, and keeps joints from forming contractures.
Occupational therapy teaches children how to perform daily tasks such as throwing balls, feeding, and dressing themselves. Speech therapy helps improve speech, understanding, and swallowing. Drugs are used to control seizures and muscle spasms. Braces can compensate for muscle imbalance. Surgery and mechanical aids can help to overcome impairments. These include orthopedic surgeries to adjust tendons or fuse joints.
For patients with severe tightness of the leg muscles, a pump can be surgically implanted to deliver a relaxing medication, baclofen, to the nerves in the spine. Another spine operation that may be necessary involves cutting specific nerves in the spinal canal to relieve spasticity. It is known as selective dorsal root rhizotomy. Hearing aids can help improve hearing. Eyeglasses or eye surgery can correct vision problems. Counseling for emotional and psychological needs and behavioral therapy may be used. Educational aid may help children reach their full academic potential. This is sometimes called special education. The parents and family of CP patients may have feelings of grief, sadness, and guilt. These feelings should be discussed with a specialist. Support groups are available to help CP patients and their families cope with their situation. If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary.
Cerebral palsy is the name given to a group of disorders that affect a child's control of movement. These disorders appear in the first few years of life. CP is caused by problems with the motor skill areas of the brain. These areas may develop abnormally or get damaged. This disrupts the brain's ability to control movement and posture. Thanks to current advances in medicine, as well as laws created to help people living with a disability, the lives of people with CP are easier and more productive than before.
Most patients with mild to moderate CP are able to lead very fruitful lives and enjoy a wide range of physical and intellectual activities.
Thank you for using Explain.